everyone. We'll go ahead and get started. I'm sure we'll have several more joining us. And thank you for joining us today for our webinar series. Today's webinar is sponsored by Bank of America. My name is Katie Metz, and I'm with the National Disability Institute. If you're listening to our webinar today through your speakers on your computer, of course, we're being audio broadcast with the webinar. Please make sure your speakers are turned on, your headphones are plugged in, and you can control the audio broadcast via the audio broadcast panel. If you accidentally close that panel, you can reopen it from the top menu item, which is Communicate, then Join Audio Broadcast. You can go to our webinar today, which I sent out the phone number to everyone. Hopefully you're able to see that. If you do not have sound capabilities on your computer, or you just prefer listening by phone, you can do so by dialing 1-877-668-490. Of course, meeting code is 960-250-423. And again, I did put that out to everyone via participation through the chat window. You need to enter an attendee ID. A few more housekeeping tips. If you notice in the lower right-hand side of your screen, we have closed captioning available for participants who are or hard of hearing or where English is a second language. You can close down if you don't want to see this or minimize the multimedia window. You can make it bigger by minimizing the windows above it, the chat window, the Q&A window, or the panelist window. If you experience any technical difficulties during the course of the webinar, use the chat box to either send me a message to Katie Metz or email me directly at metz@ndi-inc.org. Please, again, use the chat box or the Q&A box to send your questions to myself, Katie Metz, or Caroline Burke. We'll have our presenter, Sharon Brent, answer them at the end of the presentation during our Q&A session. If you're by phone and not logged into the webinar, you may also ask questions by emailing me directly at kmetz@ndi-inc.org or cburke, B-U-R-K-E, @ndi-inc.org. Please note, is being recorded and that the materials will be placed on the National Disability Institute website at www.realeconomicimpact.org. Today's webinar, we will actually post the recordings after our July 17th webinar. So these recordings will be posted on July 18th because it's a two-part series. So please do keep that in mind as well. Thank all of you for joining us today. My name is Katie Metz, and I'm a regional specialist with the Real Economic Impact Tour, the National Disability Institute. And we thank you for coming and joining us on the webinar today. The National Disability Institute, if you're not familiar, is a national research and development organization, and our mission is to promote income preservation asset development for persons with disabilities and to build an economic future for Americans with disabilities. The Economic Impact Tour specifically, our purpose is to build disability-inclusive free tax assistance, financial education, and asset-building opportunities for persons with disabilities. And I think so part of what we want to do is grow awareness that disability is a key component of diversity. And income poverty research is linked to disability, new partnerships between the asset-building and disability communities, and improve access and accommodations to financial education programs. So to do that is through our webinar series, and so we thank you for joining us today. We thank our sponsors because without them, the work that we do would not be possible. Sponsors include Walmart, Bank of America, Accorda, Institute for Economic Empowerment, Burt Institute, and of course our partners at the IRS. With that, I'm going to go ahead and turn it over to Sharon Brent, who is Director of Training and Technical Assistance with the National Disability Institute. Sharon is one of our founding directors of NDI, and so she brings with her a great knowledge base when it comes to public benefits training. And so we thank her for sharing this with us today and doing the summer learning series. So with that, I'm going to turn it over to Sharon and make you the presenter. Sharon, are you with us?
I certainly am. I am going to what I'm going to do now is I'm going to start to go through the PowerPoint. There's this is a two-part series, so today is part one. And I'd sort of like to set up the audience who's listening to let you know that this is a 90-minute presentation Part 2 is also 90 minutes. And in order to understand the complex information that comes with people with disabilities who are also on public benefit programs, be it a cash payment or be it a health insurance program, earning wages and also starting to save and have assets and have a quality of life economically, there could be concerns. So one of the education pieces that we would like to offer you is an overview of what those public benefit programs look like and also the value of earning wages and saving assets. So what I'm going to do today is I'm going to go through the PowerPoint that you have in front of you as we go through this, and also be aware that this is only 90 minutes. This will not make you an expert. It is strictly an overview. And in order to be able to become more fluent and more familiar with some of these programs, there are websites that you will have access to on your own that I encourage you to use as a resource. Here we go, and if necessary, I'm going to leave the last 30 minutes for questions. But as the audience gets larger, and just for those of you who are already on, I'm looking at the display of the number of people that are on this call, and there are over 400 people on this call as we speak. So one of the things that I want to make sure of is that you get your questions answered. So I will get cued by either Katie or Caroline, who are also both part of the panelists, that if we need more time for questions and answers, I will try to make sure that that occurs. So we go. First of all, it's important for you to understand. Whoops, I'm on the wrong play. Here we go. Let's go back to this. Here we go. Let's see here. There we are. Trying to get to the actual PowerPoint here. There we go. Nope, that's not doing it either. Let's see here. Why am I? There we go. Thank you. Sorry about that. Technical difficulties for me. Okay, we're basically the first part is understanding the asset building and benefits for people with disabilities. What I'm going to identify for you is an overview of the benefit programs, and I'm going to give you an idea of what it takes for folks to actually apply for benefits, the difference between Supplemental Security Income, which is better known as the SSI Program, and also Social Security Disability Insurance, which is the Disability Insurance Program. First of all, I want you to be very aware, because it is a wonderful resource, is the Social Security Administration's website. And as you can see, the first bullet on this page is the actual website to the Social Security Administration, www.socialsecurity.gov. That will get you to the home page. I encourage people to play around on this website because it has a wealth of information on it and is very user-friendly. It talks about the different programs, it talks about retirement, and remembering that the Social Security Administration's website belongs to all of us. Anybody who is earning wages or who also may be retired or wants to understand where your contributions go to, what the value of those contributions are that we make from our payroll. All of those kinds of information pieces are on that Social Security Administration's website. So I can't encourage you enough to actually play around on that website for those of you who have not done this. I also want to make sure that people understand there's a huge range, given the number of participants that are on this website, the knowledge base on the participants that are on this call vary tremendously. There are some of you who are probably on this call who are experts. I went into the attendee list and I recognize some of your names just as attendees. So I want you to know that there are folks on this call that are very fluent in these rules and regulations. And there are also folks that are novice, who don't know anything. When I try to give information on these kinds of information sessions, I usually try to speak to the individual who probably doesn't know very much at all. And so those of you who know a great deal, I apologize if this is redundant to you, but it's easier to train to those who don't know than versus those who know a lot. So I'm interested in questions and comments as we get to that portion of the session. You go onto the Social Security Administration's website and you're initially applying, so providing resources, applying for the benefits. It takes a tremendous amount of effort for individuals with disabilities to actually go through the application process, and that's the beginning start. There are resources on the website called the BEST Toolkit. There also is a checklist for developing an initial application, and there's also information on meeting the medical test initially, and I will give you some more information on that as we go. First of all, what meets the definition of disability? How does an individual actually get to the point of becoming eligible? The Social Security Administration looks at two pieces of information for someone who is 18 years or older to determine whether they meet the criteria and meet the definition of disability. First of all, there needs to be medical information, which you see here, it's medical determinant, whether it's physical or mental impairments, or a combination of lots of different pieces that someone might identify, and the expectation that this particular disability is going to last for at least 12 months, or there could be a diagnosis where someone may get a diagnosis that will result in death even before they reach that 12-month period. And so the Social Security Administration is looking to determine that because of that definition, because of the diagnosis, that a person is going to be unable to engage in what is called substantial gainful activity, which is employment. Are going to be able to earn, and you can see by this slide that in 2012, if a person is unable, because of medical determination, to be able to earn gross wages in a month of $1,010, or if someone qualifies under the blind regulation, they would to make less than $1,640 gross a month, they would then meet the criteria of medical determination. So initial eligibility has two components to it. One is a medical diagnosis that can be proved by medical information and resources, and the other, because of that diagnosis, unable to engage in what is called substantial gainful activity. So that's two components. Social Security, both programs, the Social Security Disability Insurance Program and the Supplemental Security Income Program, which is SSI or SSDI, are medically evaluated the same when making an initial medical determination. So it's not any different for someone who might qualify for DI versus qualifying for SSI. So the medical determination is the same for both programs. There will be some people who are going to be eligible for both cash benefits once they become eligible. That is determined by the Social Security Administration. The Disability Determination Service is a contracted agent in every single state, and it could fall under various umbrellas depending on what state we're talking about. But each state has a contracted disability determination service that actually makes the medical decisions for the Social Security Administration. So someone who's walking into a local Social Security field office will not have a medical diagnosis made by a claims representative at a local field office. You may turn in paperwork at that field office, but eventually that paperwork will then go to this state disability determination service contractor, and they will then go after all of the medical evidence, look to determine if the diagnosis is going to prevent someone from earning that marked amount of money of substantial gainful activity. But every state has one of these contracted agents with the Social Security Administration. Steps to actually go through. I encourage folks to try to understand the process of initial eligibility to engaging in any conversations with the Social Security Administration, whether it's a local field office, whether it is a calling their 1-800 number, or whether or not it is actually going online and filling out the application online. The more information that a person knows prior to starting a timeline, the better chance they will have done everything necessary to give the Social Security Administration and the Disability Determination Service, that's that state contractor, what they need to come up with a positive or the most accurate decision possible. So I encourage folks to learn about the definitions of disability, and I've given you a link here on this slide that is called the Professional Blue Book. It has all the Social Security Administration definitions of disability. It's a great way to get an idea of what it is they're looking for and what kinds of things qualify. Completing all the paperwork, giving examples of how the disability might interfere with daily activities. When you think about a person actually having to go to work, if they can't do their daily activities, if they can't function every day in the life activities, how in the world are they going to go and apply for a job or get a job? So one of the things that I encourage, and it's not necessarily an easy place to identify information because there's not a lot of rooms on a lot of these forms that Social Security Administration uses. Add documents, add paperwork, give them as much as you can, but give examples. So when you answer one of their questions, describe what it looks like to that person. A lot of times it's important to discuss that people who have a disability may not be able to fill out these forms on their own without assistance. So it's important that that becomes part of the information that you're going to share with the Social Security Administration, is that they had assistance to do this. You want to provide correct information, correct medical sources, phone numbers, and if they ask you additional questions, have them they send out additional forms to you. Make sure that you fill out the forms, and I encourage you without question, you must copy all documents prior to sending them into the Social Security Administration. So you want to have a mirrored file of your own that you have access to so that you can review it and look at it. The other piece of information, which is the last point on this particular slide, is to actually make a connection to the Disability Determination Service periodically to check on where the status of the application is. Did they get all of medical information? Are they missing information? Every state has, again, that contracted agent, and if you were to go onto a state website, you would be able to put in a search engine on that state website, Disability Determination Service, and up will come who that agent is in your state, any contact information, and that's how you would actually find out who you should contact when you're trying to process this information. There are multiple steps in the application process. If a person gets denied, they will receive a letter from the Social Security Administration, and in that letter it will also say what evidence they used and why they denied you based on what they received. You have 60 days, a person has 60 days to file what's called a reconsideration in order to keep that initial application open. It's important that people realize they need to do this within that 60-day period. It then go back to Social Security. It will go back to a different set of eyes at the Disability Determination Service, and they will review the evidence again. Or maybe there may be new information that has occurred in the waiting period that took place to got that first decision. If they deny you a second time, you will then letter with that second denial and an opportunity to file within 60 days to go to the next appeals level, which will take you into the administrative law judge system, which is part of the eligibility process. Then also, if you file within that 60 days, keep that initial application open. If a person fails to file within that 60-day window in either the reconsideration step or the second denial administrative law judge step, your application will be considered closed. If you feel like you still need to apply benefits, you would have to start over again with a new initial application date. So it's important to encourage folks, if they get these letters of denial and feel like they really are disabled, really do need to be on these benefits, and want to pursue that initial application, they need to make sure that they continue to file within these windows of time in order to keep that initial application date open. What is the Social Security Disability Insurance Program? So what we're going to do now is talk a little bit about what is SSDI versus what is SSI. So I will talk about DI first. First of all, Social Security Disability is not a program that got medical terms to it. It's a program. Social Security Disability Insurance is also part of what's called the Title II Trust Program. Social Security Disability Insurance benefits, when a person qualifies, is based on our work history. Whenever we earn wages, if you look at pay stubs, you will see that under various names, but the purpose of this is what's called FICA, Federally Insured Contributions Act. If you're an employee, a percentage of your gross wages comes out. Usually it's about 7.5% combination of payment to Title II Trust and also paying for Medicare advance, but 7.5% of your gross wages gets into your Social Security Title II Trust system, and your employer will then match that with another 7.5%. So in order to qualify under your own work history, you have to have a work history that you've earned to apply for the disability insurance program. So you have to have a work history in order to qualify, or a person may qualify for disability insurance when connected legally to a parental work history. If a person qualifies to connect to that parental work history and that parental work history has been opened by that parent worker. So basically what I'm telling you is that no one can access anyone else's work history until the worker who earned the work history has opened their own work history, and there are three ways that any of us can open our work history. We either can open it when we retire and start collecting a retirement Social Security check. We qualify on our own through a disability that we might have and open up our work history and collect Social Security disability insurance because we have a disability. Or the other way that opens up a work history is when the worker passes away and leaves the work history. Then other people who qualify could access that work history. There are various ways that a person can collect on another person's work history, but they must meet the qualifiers to collect another person's work history. And I'm guessing now some of you are already confused. That's okay. It's a complicated system. There are lots of rules and regulations. It's a very convoluted set of rules that people need to process in order to understand them. So I'm just giving you a tip of the iceberg in terms of information. So I can't encourage you enough to use the Social Security Administration's website. What is Medicare? Medicare is the health insurance that when you retire at age 65, under retirement rules, is your medical insurance. It also is the medical insurance that goes with someone who qualifies for Social Security disability insurance, because remember, that's also a work history benefit. But a person who is getting disability insurance will not qualify for Medicare health insurance for 24 months. So they have to wait, where someone who retires who is 65 or older will get Medicare once they are 65 or older when they retire. or you could qualify for Medicare even before you retire, as long as you're 65 and you have a work history. There are 3 parts to the care program, and I've listed the 3 parts for your general information. Part A provides someone with hospitalization, so you use insurance when you enter into a hospital, and there's no monthly premium to the hospitalization portion. Part B of the Medicare program buys a person medical services. So you go to an orthopedist, you go to your internist. When you're ill, it would buy some durable medical equipment, but that's what the Part B medical service piece is, and that is also has a monthly premium attached to it. The monthly premium is based on when you become eligible. It also is based on whether or not you have any pennies attached based on when you signed up. So I didn't put an amount of money there because it's going to vary depending on how you qualified. Then there's also a Part D program called the Prescription Drug Program, and that premium is going to vary, and programs are going to vary on Part D from state to state. So those are the 3 basic pieces of health insurance that get provided for someone who is qualified 24 months later on Social Security disability insurance. Medicare becomes your health insurance for you to use to support your medical needs. What happens when a person who is on Social Security disability insurance makes a decision that they may have recovered enough and wants to try to go back to work and earn wages? The Social Security Disability Insurance Program has what's called work incentives that actually encourage people to make work attempts, and also there are other pieces that are given as incentives to encourage you to even earn more money. Now, for me to go through every single one of these work incentives would take me probably at least a day. But what I did was, on this particular slide, I identified what the Social Security disability insurance work incentives are, and in red, I've given you the actual quick explanation of the protection. For instance, trial work period. A person on disability insurance makes a work the first time they go back to work. If a person is able, given the nature of their disability or their recovery, to go back to work and earn $720 a month or more, and that, I apologize, should also say 2012, because that number is the same. $720 is 2012 as well. It protects the individual's disability insurance payment, the cash pay they're receiving, and their medical insurance. No matter what they earn, they always continue to get their cash payment of disability insurance and their medical insurance, Medicare, while they're trying to go back to work, and they will be fully protected. That is called the trial work period. Now, there are additional rules to the trial work period for a period of time, but I encourage you again to go to the Social Security Administration's website, put in the search engine definition of trial work period, and it will give you all of the details of the rules and regulations on the trial work period. What I would encourage folks to do is learn more about those working rules, but know that this would be an attempt for persons to go back to work fully protected without worrying. There is a huge range of misinformation or misnomers about someone's ability to go back to work while they're on cash payments. I will tell you that there are so many incentives that help a person make work attempts to encourage them to go back to work so they don't have to worry. But in order to be fully informed, people need to learn to understand what these rules and regulations are. So I encourage you to do that. A person has used the trial work period, and again, there are 9 months of the trial work period, depending on how much you're earning and for how long you've been earning it. But you will stay in this protected period until you are able to have earned these 9 months of $1,200 or $720 or more over a period of time. But once you've been able to do such a thing, you will enter another semi-protected program, which is called the extended period of eligibility, and that's where the substantial gainful activity amounts come back in. And the amount that you see here, that $1,010, is the correct amount for 2012. And again, I apologize, but it should say 2009 in the trial work period amount as well. It should say 2012 because it's the same. The extended eligibility is a safety net. Individuals who are able to start to earn more wages up to SGA amount or more, and this window of time is for 36 months. For some months they may be able to earn SGA, some months they may not be able to. In a safety window of time, they'll be able to get their cash payment back without having to reapply. Now, if someone is unable to earn substantial gainful activity, they will not lose their cash payment as long as they maintain the medical eligibility criteria. So you always have to be medically eligible. So the other window of time that encourages folks to test their ability to earn wages or even more wages and still know that they have the ability to go back on the cash payments if they're unable to maintain that level of earnings because of their disability. The Medicare coverage is also a work incentive that even allows a person who may have been able to earn enough money, no longer receive a cash payment, but will maintain their Medicare health insurance for a much longer window of time. I can tell you that from the time someone starts earning trial work, goes through the extended period of eligibility, and 54 months after they may not be eligible for a cash payment anymore, could still be eligible for Medicare. So they have the opportunity to have Medicare much longer, even though they may not be eligible for the disability insurance cash payment any longer. So again, that's another incentive, because a lot of folks are more concerned about having the health insurance than they are about having the cash payment. So it's important to realize that the insurance could be just as valuable to someone as the cash payment in order for them to support their disability. I'm reading you again under special rules for the blind that the substantial gainful activity gross wage amount in 2012 is $1,640. You'll see that that's more than the other disability SGA, which is still $1,010. Just for your own information, basically the special rules for the blind came because of the lobbying that was done when the rules and regulations were initially implemented. So lobbying did a great job. But you'll also think about when you read pamphlets or you look language that the Social Security Administration puts together in definitions, you'll always see aged, blind, and disabled. So the aged is someone who is 65 years or older. Someone who is blind must meet the criteria of the Social Security Administration's definition of blind, and then, of course, all other disabilities are all lumped together. So only aged folks, 65 and older, or someone who meets the blind criteria are segregated out with special rules. Other things that when an individual who has a disability on disability insurance, cash payment, is earning wages, and some of the things that they need to support a disability in order to earn those wages, they are paying for out of their own pocket. That work incentive is called an impairment-related work expense, out-of-pocket expenses. So the individual must be paying for these expenses out of their own pocket that supports their disability in order for them to earn wages. So an example might be copays for medication or specialized transportation that Medicare doesn't pay for, that no one else is covering, that they're paying for out of their own pocket for themselves in order for them to earn the wages. So that's another work incentive that's used. Another work incentive you see here is Section 301, which protects benefits when not medically eligible. If a person is in a vocational rehabilitation plan and they come up against what's called a continuing disability review, every beneficiary, whether it's SSI or disability insurance, will periodically be medically reviewed. Go through that process during person's initial eligibility that they went through while they're still on cash payments. Periodically, Social Security Administration will determine whether they are still medically eligible, and that's what's a medical review. If a person goes through a medical review and is denied, no longer considered medically eligible, but they're in a vocational rehabilitation plan, they could continue to keep their cash payment and the medical insurance that goes with it and until they complete the plan. There are very specific rules to it, and you have to meet all of those rules. There are also going to be folks under special conditions and subsidies when an individual is able to earn wages above substantial gainful activity, so above that $1,010 a month, but they are unable to do that without a number of supports they're receiving. So it may be some of you are going to understand the terminology of job coaching or customized employment or supported employment or enclave employment. Those kinds of employments have supports built in. But an individual might be able to earn above the SGA as part of their pay stub amount. So in order for Social Security disability insurance not to count the actual wages as SGA, we have to then submit information on how the person is receiving supports and the value of that support. And that's what special conditions and subsidies is calculating the value of the work actually earned. Expedited reinstatement is a quick method for a person who was on disability insurance, still has a disability, and was earning substantial gainful activity to ask for that cash payment to be given back quickly because their disability, again, seems to be interfering with their ability to earn substantial gainful activity. So that's what expedited reinstatement is a quick method to get the cash back, and then the medical review will take place, but it's because the disability has flared up enough that they're no longer able to continue to earn substantial gainful activity. There's also what's called the Ticket to Work program. This is a program that anybody who's on disability insurance benefits or even SSI benefits between ages of 16 and 64 could actually go to what's called an employment network or to their state vocational rehabilitation system and have what's developed as a work plan and enter into an agreement using their Ticket to Work program that the Social Security Administration contracts with these vocational programs to help a person look for a job, help them develop a resume. They might provide some training to get them retrained to do a job, but that's what the Ticket to Work program is. Slide. Supplemental Security Income, SSI. So now we're leaving the disability insurance program and we're going to the rules of Supplemental Security Income. SSI, also known as the Title 16 program, also is not a medical term. It is a program. And Social Security Administration's SSI program is funded with federal income tax. So all of us who pay our taxes goes into a general federal income tax form and fund, and an SSI payment at the federal level is what is making those payments to those folks that qualify for an SSI payment. So it's a taxpayer's dollar. And one of the criteria, along with the medical side, remember that medical eligibility for SSI is identical to the medical criteria and definition for disability insurance. If you're 18 years or older, you must prove that you are diagnosis, you meet a medical definition, and because of that medical definition, you are unable to earn substantial gainful activity. The other criteria that's the medical criteria. The other criteria for SSI, which is not part of the disability insurance program, is you also must meet the financial test. So someone must be both medically eligible and financially eligible to qualify for an SSI dollar. Why? Because it's a taxpayer's dollar that they're giving. So they're protecting taxpayers when they are making sure that someone actually needs to be on an SSI dollar. The maximum benefit rate, 2012, is $698. If I live in a state that gives only the federal benefit rate, the maximum I'm going to qualify for in that state is $198 of the federal benefit rate if I qualify for the maximum full amount. If I am in a state that also has a state dollar that supplements the federal benefit rate, my SSI amount may be higher in that state because it's a combination of the federal benefit rate and also a state dollar that gets identified because I live in that state. The Social Security Administration's SSI program looks at 3 pieces of information when they're determining someone being financially eligible, and also what they're required to look at before they give you either $1 of the federal benefit rate or any amount up to the $698. They're going to look at what is called unearned income. They're going to look at wages, and they're going to look at resources. Okay? So those are the 3 categories of what looks at that financial criteria. And in order to be a little bit clearer about what those resources are, and I'm going to go back. For instance, an example, unearned income would be someone who might be receiving a disability insurance payment from SSDI. It might be somebody who's receiving a Veterans Administration cash payment. It might be someone who is receiving a monthly annuity from some sort of a settlement or a trust that they receive an amount of money every month. It might be wages from a spouse. It also might be, let's see, what could it be? It could be alimony. So I was married and I'm receiving an amount of money every month from alimony, and I also meet medically the definition, but I don't have quite enough money. So SSI is going to say, okay, we're going to look at your alimony and we're going to count it and we're going to subtract an amount of money from the $698 to give you a portion of SSI because of the amount of money of unearned income you're receiving. So that's how someone gets a reduced amount of SSI, because they're required to look at everything else you're receiving in a month before they give you any of this supplement of that $698. The same way with wages, and I will get to a wage formula as we go through these slides so you can get an example of what that looks like. And then you also have resources, and resources are things that accumulate over time, things that we save, things that we accumulate in terms of possessions that SSI will either exclude or they will need to count. And the medical insurance that goes with the SSI side is the Medicaid system. And Medicaid is administered by every state. And so it's important to realize that every state is required to look at someone who qualifies for the federal SSI payment to determine if they're going to qualify for the state Medicaid program. One of that criteria is qualifying and meeting the medical definition and the federal definition of disability. So an SSI eligibility opens up one of the state Medicaid doors. Every state has multiple doors into Medicaid. One of those doors is through the eligibility of SSI. But again, it is administered by the state, not by the Social Security Administration. I also can tell you that most states follow the federal SSI eligibility rules to determine Medicaid eligibility in the state. So they'll look at the definition of disability, and they will also look at the financial criteria. Not in every state, but in most states. It's always important, too, that if you are interested in knowing more about your state Medicaid program, I would encourage you to go to your state government website, put in Medicaid, and it'll give you a ton of information about Medicaid in your state. There are also some states that automatically make someone eligible for Medicaid when you are eligible for an SSI dollar. In some states, you may have to apply separately in that state to qualify for the Medicaid program. But again, it would open up that door when you have the eligibility of SSI in your hand and you go to the Medicaid eligibility offices and show that you are qualified for SSI as well. It's one of those doors that tends to open up easier when you already qualify for the SSI program. Remember, Medicaid is administered by the state, not by the Social Security Administration. There's always questions about these other programs that Medicaid seems to have, which are called waivers. As you can see, Medicaid waivers are additional services that don't normally fall under the regular Medicaid program, which is your medical services. If you only have Medicaid, you can use your Medicaid card to get paid for hospitalizations, for prescription drugs, for medical services. But there are some folks that need above and beyond the basic Medicaid services, and they must qualify in that state for those programs that have waived rules for the basic state Medicaid plans in that state. So every state has their own waivers because it's basically an agreement that the state makes with Center for Medicare and Medicaid Services. So I would come into one state, qualify for a waiver. I could move to another state, and they may not have that same waiver. And I may not qualify for that waiver and not get the same services. So it's important that people are aware that when an individual has those needs, then they need to make sure that they are going to qualify or that they may be waiting list when they move from one state to another. But basically, that's what waivers are. They're additional services above and beyond the basic Medicaid services in that state for everybody that qualifies for Medicaid. Now, I told you a little bit earlier, I was going to show you an example of when I'm on SSI and start earning wages, how does SSI formulate the wages? And again, this is another area where there's a lot of misunderstanding and a lot of concern about a fear of going out and earning wages. I can tell you generally that when a person qualifies for an SSI payment and they're earning wages, they're going to have more money to live on every month than if they're just receiving an SSI cash payment. Use the example here of someone who's earning a gross wage of $1,085 a month. SSI identifies that there's a general exclusion that they're automatically going to give of $20. There's also what's called an earned income exclusion, so they're also going to automatically give you the $65. So now they're only going to count $1,000. It identifies that for every $2 a person earns, they're only going to count $1. So when you divide that, that's the $500. Now, if someone was qualified for the full $698, they were getting that, and that should also say 2012, not 09. So that's another concern, is that it's important that you make that note. It should say 12, not 09, because the federal benefit rate in 2012 is $698. They now have earned $1,085. SSI is going to count only $500 of that $1,085 that I earned, and I will still qualify for $198 of an SSI supplement when I've earned $1,085 in wages. My new gross amount that I can live on that I earned is $1,283 in a month. So every month you report wages, and it's a requirement that every month you earn wages, you report wages the first week of the following month without fail, because eventually they would catch up and someone would get an overpayment. Because if you continue to get that $698 when you're earning $1,085 a month, eventually they will catch up and you're going to get an overpayment for every SSI dollar that a person was not qualified to receive. So I can't encourage you enough to encourage people to earn wages, because they're going to earn a lot more, have a lot more to live on than just that $698, as long as people pay attention to the rules. Now, also SSI incentives when someone is earning wages. And each one of these incentives has major rules to them, but they're wonderful incentives for the right purpose. And every work incentive that you see here on this slide has a value, and you can use one work incentive or you can use multiple work incentives because they each provide something different. Someone who meets the student earned income exclusion criteria can have wages excluded and not count at all if they meet the criteria under the student earned income exclusion. So they're earning wages and still getting full SSI if they meet that criteria. One who meets the blind rules could have out-of-pocket expenses 100% counted if they're paying for things out of their own pocket that support their disability, or just the pocket expenses, because the blind work expense is very liberal when it talks about what those out-of-pocket expenses might look like. The work incentive called 1619A protects SGA under the SSI rules. So I could be earning, and if you think about the wage example I used of $1,085, that's more than the $1,010 of the SGA number. Under SSI, they don't care about SGA. They only care about how much you're earning, so they can determine how much of an SSI payment you're entitled to receive. For 1619B, if a person throws out their SSI cash payment due to wages, 1619B will continue to protect their Medicaid status. So I can earn more wages than SSI covers, so I can lose my cash payment because I've earned wages enough to no longer qualify when I do that formula. But as long as I maintain medical eligibility and maintain the financial criteria, I continue to keep my Medicaid. Now, every state has a different annual income amount that I can reach. It's called the state threshold. So I would need to know in my state how 1619B applies under the Medicaid rules in that state. But every state is entitled to use 1619B because it really belongs to SSI. It doesn't belong to Medicaid, but every state has a different amount of annual earned income that maintains their eligibility to the Medicaid in that state. You have to, again, know what that state number is because it's going to vary from state to state. Incentive that helps somebody save in a protected program that will not count as a resource or a savings account against that resource limitation to help somebody pay for things to reach an occupational objective. So that might be tools, it might be tuition, it might be books, it might be supplies, it may be a laptop computer. So what do I have to spend money on to help me reach an occupational objective? And this program has a significant document that helps you plan and how you would submit that. It has its own special rules and regulations. Property essential for self-support protects resources because you need those resources in order to earn wages. So that also has very specific rules. You'll also notice that SSI also uses the impairment-related work expense, which is also a work incentive that is used in the SSDI program for the same purpose. Anything that a person pays for out of their own pocket that supports their disability in order for them to earn wages could qualify to use the impairment-related work expense work incentive. Section 1 also was explained under disability insurance rules because they both use this work incentive. The same with special conditions and subsidies, expedited reinstatement, and so the Ticket to Work vocational program. So there are some work incentives that belong only to disability insurance, some incentives that belong only to SSI, and there's some of the work incentives that both programs could use. Contact information here. One of the things that I also just want to remind you about is that it's very possible for someone who would qualify for both an SSDI payment and an SSI payment, depending on how much someone is receiving from the disability insurance payment. When an individual is on both cash payments, also are qualified for both medical insurances, Medicare and Medicaid. You can use both those insurances when you go to the hospital, when you go to your doctor, when you go to buy your prescription drugs, depending, and it's who pays first. And because Medicare and Social Security disability insurance are earned through a work history, that is always going to be the first payer. Remember that SSI and Medicaid are a need-based program based on medical definition and financial criteria. What I think I'm going to do now is stop and end up to questions. We have about 30 minutes left, and I, again, encourage you to ask the questions, and I will do my best to answer them for you.
I've been unmuted. Hello, everyone. This is Caroline Burke, and Sharon, I have the first question for you. It's from Louisa, and she wanted you to talk a bit about people that decide to work but need a caregiver. Do people just have to pay out of pocket? Is it a medical expense to get a tax benefit, or are there other ways to not get penalized for making working wages?
Okay, first of all, it depends on what state you're living in, and it also would depend on what you qualify for in that state. So an example might be when I talk a little bit about what Medicaid waivers were. If a person has the ability to earn wages but needs supports, and depending on what their disability definition is and whether or not that particular state has a waiver, a person might qualify for that in-home support service because they qualify for a Medicaid waiver. That's one of the things that a waiver can buy a person that is not usually funded by the regular Medicaid services. And again, under Medicare, usually if only through a rehabilitation program is there a window of time that Medicare might buy an in-home support service. If a person is earning wages and they're paying for those kinds of supports themselves, they could use the impairment-related work expense. Because if I don't have those supports to help me get ready to go to work, either by bathing or getting out of bed or setting me up to work, if I didn't have that service of support, I wouldn't be able to earn the wages. So I might be paying for those out-of-pocket expenses and using the impairment-related work expense so that both disability insurance and or SSI would not count all of my wages because I'm spending this money every month out of my income to support myself in order for me to earn wages. I hope that answers the question. Long version, but...
Well, thank you, Sharon.
Sure.
The next question is from Christine, and she asks, does a disabled child have to wait for 24 months for Medicare? My daughter will be 18 in 6 months and will be applying for SSI.
Okay, remembering that disability insurance goes with Medicare. usually is not on disability insurance. A minor is usually on what's called dependent minor benefits because a parental work history opened, and Medicare does not go with a dependent minor benefit. At the age of 18, when you start to apply, if you're going to apply for SSI, that would be Medicaid. And there's no waiting time. When you're eligible for an SSI payment, depending on your state, you would either automatically get Medicaid when you're eligible for SSI, or you would want to go to apply at your eligibility workers, usually it's your Department of Social Services, that are your eligibility Medicaid workers, and qualify through Medicaid that way. But there's no waiting period like there is with Medicare and disability insurance for SSI and the Medicaid.
Wonderful. Thank you. So the next question is from Amber, and she wants to know what happens if someone applies for disability in one state and becomes homeless and ends up moving out of state before a determination is reached.
I'll tell you, first of all, you would want to make sure that someone is in regular communication with the individual, because Social Security is going to send out documentation if there's no place for an address to where people can use either a post office box or something that's going to be able to make sure that they're getting the paperwork from Social Security in a timely manner. Because, again, if someone does not follow the timeline, so if I were to get a denial, or if someone fails to fill a document that they're requesting you fill out and you never get the document because you've either moved or you don't have an address to have something sent to, basically what happened is that timeline would be exhausted and a person would have to start over again. So the biggest concern that I would have in that question is that someone stay in connection, in communication with the Social Security Administration on behalf of this individual who is either going to move out of state or become homeless. But moving out of state and informing Social Security that you have a change of address should that should help. That moving out of state would not have anything to do with the eligibility, other than the fact that it may be different amount of money if it's an SSI payment. The Social Security disability insurance, remember, is based on a work history. It doesn't matter what state you live in. You're going to be entitled to the cash payment amount depending on your work history, not in what state you're living in.
Well, thank you so much. Great. So the next question is from John, and he wants to know a little bit more about who's determining what disability is. He's asking, are these individuals that are making the determination qualified, such as medical doctors or practitioners? And if not, how are informed, educated decisions being made about whether a person has a disability?
Good question. Again, there is a contracted agent in every state, and it's usually it's a department in a state called the Disability Determination Service. Those are technical analysts, and they have at their ready access MDs who are qualified to read medical records, to make a determination, and to diagnose the information that outside medical doctors have provided. So your own physicians, your own orthopedic doctor, your own neurologist, your own cardiologist would be requested to send their medical documents to the Disability Determination Service. And inside that system, either a cardiologist will look at the records depending on what the disability is. Again, reminding everyone that the Disability Determination Service is a contracted agent with the Social Security Administration. So they're required to use the Social Security Administration's definitions to make their determination. They are professionals. That is also why a local field office claims representative doesn't make medical determination, because they're not qualified to do it. So a medical decision made by a claims representative at a local field office. Those medical definitions and determinations are made by the Disability Determination Service because they are qualified and professional to do that.
you, Sharon. All right, the next question comes from Deb, and she would like to know if a person qualifies for SSI and Medicaid in one state, will benefits automatically transfer to another state if the person moves? And how do you get more information on that process?
I'll be very honest with you. The word automatic is very dangerous when you talk about the Social Security Administration. So I encourage you to always, when you move, whether it's in-state or out-of-state, you always need to inform the Social Security Administration of an address change. Would change from one state to another depends on the state. The federal benefit rate is the same in every state. It's whether a person moves from one state that has a state supplement to SSI to another state that does not. So in state, I might be receiving, let's say, $800 of a payment from SSI. $689 of it is the federal benefit rate, and the rest of it comes from the state. Now I'm going to move to another state where that state doesn't have a state supplement, so the maximum I'm now going to get in the new state would be only the federal benefit rate of $698. So you always have to make address change. There is nothing automatic about moving from one state to another with informing Social Security. You are required to do that, or you may not get your cash payment. Now, one of the safety nets that I try to help folks understand is if you have your payment, whether it's an SSI payment or it's a disability insurance payment, go direct deposit into a banking institution, into an account. A lot of times people move and then they make the changes of their account. So if SSI payment continues to go into that direct deposit account, someone will continue to have access to their money in a current bank account. But again, you want to make sure that as soon as you have an address, you report address change. I encourage you to do it two different ways. Online, three different ways, really. Do it online. Do it calling the 1-800 number, their information number, and also put it in writing and sending it to the local field office of the zip code that you just moved to versus the one that you're leaving. So three ways that you have that you're wanting to inform them. And then, unfortunately, I also have to tell you, you need to follow up. If they don't seem like they've got the address change, then you need to do it again. Big system. So we're here to look after the beneficiary. The Social Security Administration has got way too many places that they need to go in, so we have to worry about ourselves and what know.
Thank you so much, Sharon. All right. The next question comes from Gwendolyn, and she wants to know what happens if a person who has not worked themselves and is collecting SSI because of a parent. What happens to that person when the parent dies? In this particular instance, the person was not working themselves and they were disabled. And so Gwendolyn wants to know what that person would have to live on.
Okay. First of all, it would depend on whether or not the individual who is disabled can prove that the disability has occurred before the age of 22. Then if you can prove that, the parental work history opens. So who is this person connected to parental-wise? And a parent has a work history. So that parental work history opens. Whether they have opened it and collected a retirement benefit, whether they've opened it and collected disability insurance because they're disabled, they have passed away. If that adult child that we're talking about on SSI can prove they were disabled before the age of 22, they then qualify, once that parental work history opens, to what is called a disabled adult child benefit, and they would then qualify for a disability insurance payment based on the parental work history. That means they might lose their SSI depending on how much of the unearned income SSI is required to count that is coming from the disability insurance payment. or it may just be a reduction of an SSI payment depending on how much they would be receiving from the parental work history. So whether the parent is retired or disabled or has passed away, that parental work history would stay in motion even after the parent passed away if a beneficiary, if the person with the disability can prove that their disability occurred before the age of 22 and they are not married to someone who is not on a Title II benefit. There's some more detailed rules, but that you need to understand what the rules are to that adult child status. So if the parent is alive or dead isn't the issue. It's whether or not that individual adult child qualified to begin with.
Great. This next question is from Lenore, and Lenore asks, a person needs 6 quarters of credit if disabled before the age of 24 to qualify for SSDI. If they're disabled from birth, in what time frame do these 6 quarters need to be earned? I can't get a clear answer from SSA, and they must be earned in 3 consecutive years. It must be earned in 3 consecutive years. Excuse me.
Okay. So, now I'm not quite sure I understand the question, because are we talking about a person who is on SSI and is young, 26, go out and earn money, and then becomes disabled enough that they also need to qualify for disability insurance? And how many quarters do they need to have? I will tell you, you could go in to the Social Security Administration's website, and you actually, on the left-hand side of the screen, you can identify how earnings apply to the quarters. So you can get a determination, because it also makes a difference about how old we are when we become disabled and how much we're required to earn in credits, in dollars, to get the credits before we qualify for disability insurance. Because you do have to have current work history in order to qualify for a DI payment. But the younger we are, the less work credits and the less time is required than if we're old, if we become disabled, say, after the age of 31. So again, variations to that answer, because it depends on how much we've earned, how old we are when the disability occurred, and how old are those work credits.
So maybe, Lenore, if you have some follow-up questions, you can feel free to shoot those to me, and I'll pass them along to Sharon. All right, so the next question is from Amber, and she wants to know what kinds of resources, wages, and unearned income go to the SSI eligibility formula.
Okay, so first of all, unearned income, again, that has categories to it. It's something that's pretty consistent that a person gets every single month. SSI is required, again, to look at everything an individual receives every month before they give out any of the 698 supplement. Unearned income touches the 698 by identifying a general exclusion. So as an example, let's say I am receiving $420 a month of disability insurance payment. Okay? SSI says, okay, Sharon, we have to count $4 of that, but we will give you general exclusion of $20. So if the federal benefit rate is $698, we're not going to be able to give you the whole $68, because we have to count the unearned income dollar for dollar, with the exception of that $20 general exclusion. So we're going to give you $298 of SSI because you're receiving $420 of DI. That's how unearned income touches the SSI payment. The formula I showed you. So it's minus the exclusions, be it the general exclusion or the earned income exclusion. Then you divide by 2, and then they would subtract countable wages against the federal benefit rate. So it depends on how much wage you earn, and that's a month-to-month calculation, depending on how much money you are earning in wages. Resources are things that accumulate over time. If you are an individual adult, 18 years or older, you're allowed to have up to $2,000 in accumulated resources in various categories. If you're a married couple, you're allowed $3,000 of resources in a month. Now, my concern is that you don't get to that $2,000 or $3,000 limit, because as soon as it hits $2,000, that's your maximum. $1 over, so if you have a savings account that's got $2,000 in it and it's time for somebody to get an interest payment, they're going to get dinged for over the $2,000. So I encourage folks to keep their resource limits below the $2,000, $3,000 mark.
Great. So this next question comes from Bobby, and Bobby asks, if you're already on SSDI, how do you determine if you're eligible for SSI?
Depending on what your financial picture looks like, okay, so do you have of over $2,000 or $3,000, that would be the first place you'd go, because if you are over, that automatically disqualifies you from that financial criteria that belongs to SSI. The other piece is how much money is a person receiving from the disability insurance cash payment every month. And if it is over $698, it would be $698 plus 20, 8, 11. It would be $718. If you're getting $718 a month from a disability insurance check or above, you're going to not qualify for an SSI payment. If you're receiving $8 or $900 or $1,000 from a disability insurance payment, you're not going to financially qualify for an SSI payment, because they're going to have to look at your disability insurance payment before they qualify you for a supplement of SSI. Now, that doesn't mean you might not qualify for Medicaid, which is health insurance in your state, because that is based on finances and medical. So in some states, they will allow you to enter a different door into Medicaid when you financially qualify for their Medicaid program in that state. You're already medically eligible, because you're medically eligible definition-wise because you're receiving a disability insurance payment. But if you're receiving a higher monthly payment from D, you may not financially qualify for Medicaid in your state. So they allow you to go in and they'll do a financial on you to determine whether or not you would pay anything first before then Medicaid becomes part of your insurance program. It varies from state to state. That is a state program, not a federal program.
I think the question's kind of adjacent and probably already answered, but I'll just put it out there just so we can get it very clear. Renee wants to know if you can qualify for both SSDI and SSI.
Yes, depending on what unearned income is, so depending on how much you're receiving from DI, and whether or not you are also financially eligible for an SSI payment. So another example that I could give you, I could be receiving only $420 a month from disability insurance, but I have $10,000 in a savings account. Because you have $10,000 in your savings account, that's going to automatically disqualify you from meeting the financial criteria of SSI, because you're only allowed to have $2,000 or less if you're a single adult 18 years or older. It isn't going to disqualify you for DI's payment of that $420, because disability insurance doesn't look at assets, because you earned that money or you're receiving it from a parental earned work history. You earned it. You are not receiving a taxpayer's dollar when you're receiving disability insurance payments, only if you're receiving SSI. If you meet the financial criteria and you don't have more assets than that $2,000 limit, if you're a single person 18 years or older, and you're receiving $420 of disability insurance, SSI says, okay, we're not going to count that $20. That's going to be the general exclusion, but we're going to be required to count the $400, and we're only going to be able to give you $298 of an SSI cash payment, because you've got $400 we have to count of disability insurance, which is considered unearned income.
Thank you. All right, the next question comes from Howard, and he would like you to explain briefly how waivers work.
Okay, now remember, waivers are a state to state. So every state has their own grouping of waivers. And basically what the state has done is they have developed what they are interested in additionally providing a particular kind of individual that they've identified and have written the actual information and had it approved by the Federal Center for Medicare and Medicaid Services. When the federal system, CMS, approves that waiver, then there's going to be a group of folks that are going to become eligible because they look a certain way, so they have a kind of disability, and if they qualify, they will get additional services that regular state Medicaid does not provide everybody that's on Medicaid in the state. And a lot of times it is a combination of state funds and federal funds, so there's also a limit on the number of people who can qualify for a waiver at any given time. So that's why you probably hear a lot about waiting lists and waiver services. But they're very specific about the eligibility criteria to qualify for a waiver. So you also, though, could have people that qualify for the waiver but don't get funded yet because they're on a waiting list because they look a certain way. So waivers might buy employment support, supported living support, individual transportation support that's different. It might provide job tools, depending on how the state developed the language in the waiver and what they were hoping that waiver would provide an individual. Every state has their own crop of waivers.
Excellent. This next question comes from Bobby, and the question is if you could please explain briefly once again just what earned income is.
Yes. Earned income for both programs, earned income is when you are receiving a payment for your time. So it could be self-employment. It could be actually as an employee. You could be a student on a work program and you're receiving a wage for being a part-time student and on a campus. So anything that gives you a wage, that's paying you something for your time, is considered wages for both disability insurance and SSI.
Great. Next question is from Gloria, and she would like to know, how does being a recipient of a parent's pension affect the individual's SSI or SSDI? The amount in this case would be about $600 a month, and I can't find a way to put it into her special needs trust. I.e. Gloria.
Okay, so first of all, the pension is going to be considered unearned income to the SSI program. So if I'm an adult, 18 years older, but I'm getting this parental pension every single month of $6, SSI says, okay, we will not count the first $20, but we have to count $580 of the $600. So if you're in a state where the state supplement, the federal benefit rate is still the $698, then we're going to subtract the $580 from the $698, and you'll get a small amount of an SSI payment. So a pension becomes unearned income to the SSI program. Now, depending on where the pension is coming from and whether the person qualifies for disability insurance, and is it the actual worker or whether or not it's a child that's qualified for this pension, could still qualify for disability insurance from a per work history as long as the pension isn't considered the value of that work history. So that's a little bit more convoluted because a lot of times someone could be qualified for a federal pension, but also then once they retired from the federal system goes out and works in a regular civil service job and starts qualifying for Federal Insurance Contributions Act because they're putting into FICA. So it really is going to depend. That's a more individual that we would have to delve into to know where all those connectors are. So and why that's confusing. confusing when there aren't connectors. So when there are more connectors, it's even more confusing.
Absolutely. All right, the next question's from Matt, and Matt asks, you were saying that there were 3 ways someone can open up their work history on SSDI. Could you please explain more about the second option you mentioned and which one was linked to disability?
First of all, there are 3 ways any of us can open our work history. We have a work history and we retire. And when we open our work history at whatever age that we've chosen to retire, starting from 62 on, we would open our work history and collect retirement benefits. That's one system. The next one would be, we could be a worker who all of a sudden, let's say, has severe heart disease and they're only 55 years old, but they've worked up to 55, and they're no longer able to work anymore because the heart disease has been preventing them now from earning substantial gainful activity. So they have to go through the medical eligibility process. They have a work history, and they now are medically eligible. That opens up their work history, and they would get a payment from that work history under disability insurance rules because they're medically eligible. Third way is when a son or daughter starts to qualify because the parental work history opens, and that son or daughter has proven that they were disabled before the age of 22 and is connected to that parental work history when it opens.
Fantastic. The next question I have is from Andrea, and she asks, or she's actually speaking to Lenore, and she wanted to let you know that the information she received from Social Security says that if you become disabled before age 24, in order to meet the recent work test, you need 1.5 years of work during the 3-year period ending with the quarter your disability began.
And that's probably very true.
So
I would have to know how much they earned and how long it took them to qualify for the benefit, when they applied, and when did they start the clock. So it's also important, date of application. All of those pieces are factors in when the clock starts.
Excellent. All right. Stephen asks, a cognitively disabled person is currently working. How should he work in order to qualify for SSDI and Medicare?
Again, how much he's earning working and how old he is. The fact that he's got an intellectual disability is not a factor other than if he can prove that he was disabled before the age of 22 and he doesn't have enough of a work history and his parental work history open, there's a good chance because of the kind of disability he has and can medically prove disability prior to 22 could qualify under disability insurance rules from a parental work history.
The next question comes from Amy, and she would like to know, can you claim under a spouse's eligibility, like the parental claim idea?
No. If you're disabled, you cannot claim disability benefits from a spouse's work history, if that's the question. It can only be from your own work history. There's only a connection in the death benefit portion of the rules and also retirement rules, but not disability insurance.
All right, great. Now, Sharon, it's a little past 3:30. So, what are you thinking in terms of continuing with questions?
Well, I'm happy to do this if you want to, or as you can see on the last slide that you see, you have my email address. Also should tell you that both Elizabeth Jennings and Michael Roush, who also work for the National Disability Institute, as well as Katie and Caroline, could also answer questions about benefits themselves. The other one, I would be willing to entertain a window of time, another 15 minutes. I am sort of going to leave that to both you, Katie, and to Caroline in terms of the protocol.
Okay. Well, I can say that there's about 15 more questions that I have just here, so I don't think that realistically we'll be able to make them get through them. But Katie, I'll defer to you in terms of what you want to do.
It's actually, Sharon, we have over a total of 45 questions that have been coming in as we've been going along. So I know we won't be able to get all of them, but I have recorded them all. So what I would say is that since we probably will log out of the WebEx because we allotted our What I can do is I can send all these questions to you, and if you don't mind, we can work on getting written answers, and then we can post those with the archive webinars, or we can save some of them for part 2. Just
okay, and I can start to answer some of those questions prior to us starting with the new information on part 2. So if everybody would like to hear some of the questions and answers, I'm happy to do that as well.
Yes, I can send all of those to you. Okay. And then, like you said, we can kind of work on those for next time. And so with as well, I want to remind everyone that we are scheduled for part 2, which would be June 17th, a week from today at 2 o'clock Eastern Time.
June 17th.
It says June, but it's July. I understand those mistakes. Trust me, I did it twice.
Oh, yes, me too.
July 17th, this past June. So, yeah, everyone that will be joining us today who attended will receive an email update from WebEx through our server that will give them the link to next week's webinar, and so they'll just need to sign on. They'll also receive a link later on today with today's PowerPoint. We were receiving multiple questions on how to get a copy of the PowerPoint. And finally, both this webinar and next week's webinar is being recorded, and we will post those along with the PowerPoint presentations and any questions that were answered. All of that will be posted on our website starting July 18th, the day after the next webinar is recorded. So with that, I want to thank everyone for being on today. I think it was wonderfully informative, Sharon, and I think by all the questions that have been asked and everyone's attention to it, it's obviously a very interesting topic and one that is really needed in the community. So with that, I will turn it back to you, Sharon, if you have any closing words, and we look forward to having everyone on next week as well.
The only thing that I will tell you is encourage folks to go to work, try to understand the rules, use the Social Security Administration's website to learn more. While I know it seems daunting because the rules are very complicated, it's much better economically when someone is on benefits, cash or insurance, and earning wages. I encourage people to go out and earn wages. Create the opportunity.
Thanks, Sharon. And with that, like I said, we thank everyone. We thank all our sponsors, and we look forward to hearing from you all next week on July 17th at 2 o'clock Eastern Time. Thank you, everyone.